They told you, with your personality, with your hair, with your hijab, with your skin colour, with your preferences, with your gender. They told you, with their silence, with their words, with their resentment, with their absence. They told you, you don't belong. Yet, here you are.
Hi there, my name is King. I'm currently intercalating in a Master's in Research at Bristol. I'm the ASiT 7 Medical Student Rep, and I'm also the co-president of Bristol Scrubs Surgical Society.
Hello, my name is Melissa Matthews and I'm a third-year medical student at Hull York Medical School. I'm the ASiT Humber and Yorkshire Medical Student Rep and I'm on the organising committee for the surgical conference.
Hi, my name's Ellie Priestman. I'm a fourth-year medical student at Bristol University. I'm also the Equality and Diversity Ambassadors co-chair, as well as being the vice president at Bristol Women in Surgery Society.
Hi, I'm Michael Okacha. I'm a General Surgery Registrar and I'm the Association of Surgeons in Training Equality and Diversity Officer.
Mr. Griffiths is a consultant vascular and trauma surgeon and lead for trauma surgery at Barts NHS Trust. He's also the first National Clinical Director for Violence Reduction for the NHS England. Mr. Griffiths has spent over 20 years working in schools to reduce knife and gang violence. He's since gone on to educate others at both St Bart's and Brighton and Sussex Medical School, as well as several courses at the Royal College of Surgeons. Mr. Griffiths has earned several accolades. In 2018 alone, he received the Hero Doctor Award from the NHS Hero Awards, was named as one of the top 1,000 most influential Londoners by the Evening Standard, and delivered a keynote address at the NHS 70 celebration. As part of the violence and trauma team at the Royal London Hospital, he was awarded BMJ Prevention and Lifestyle Team of the Year Award. He has since been named one of the most influential Black and minority ethnic group members by the Health Service Journal last year. As a passionate advocate for diversity and equality, Mr. Griffith was also the first appointed ambassador of the Mary Seacole Trust.
Hi, Mr. Griffiths. Could you
Hi,
take
Ken. How you doing? You all right?
Yeah, good. Could you take us through a typical day in your life, please? Thank you.
So the problem is I have no typical days. I've got like 3 different jobs. So if I talk about my clinical day, okay, or I'm doing trauma, I'll get up in the morning, not beat my children, run to work, and I'll do 9 to 5 as a trauma surgeon when I lead and manage that service. And we basically react to the management of major trauma within the major trauma centre. I coordinate care, I operate, I teach, I train, I do meetings, and I do my own course. So I just do major trauma surgery, visceral, vascular. When I'm not doing trauma surgery, trauma weeks, I do a lot of work for NHS England, and that's mainly around coordinating the activities of the Violence Reduction programme in London and nationally, and that's mainly about coordinating my work streams, taking with my clinical leads, having a series of meetings with various health and non-health bodies, discussing strategy, and then fitting in also operational time with programs and teams to do that kind of work. And then in the NHSE time, I will give quite a lot of talks and sessions around what practice I do, and also we'll do some operational work looking at how we can build programs and services in and around the community that I serve. Also a fair bit of training. So interspersed with that, I'll be training anybody from professors to our cleaning staff about violence reduction, talking about surgical training itself, about clinical practice, about trauma-informed practice, about what we do. So it's a bit of a mixed bag. So I'm sort of half-time clinical, doing trauma and vascular surgery, half-time NHS doing violence reduction. I do a fair bit of ambassadorial work around diversity in healthcare practice with Reach Society, Untitled Trust. A bit of time with Charlton Athletic Community Trust. I'm a Charlton fan, I know for my sins, as a trustee of that charity, and I do a fair bit of work in education, looking at courses as well. So it's a bit of a funny old day.
Thank you. Can you take us through your childhood?
Yeah. So I grew up in southeast London, a little village called Lewisham, and that's sort of, when I grew up, it was quite a punchy part of the world. So I grew up with my mum and my sister. Dad was sort of in and out of the picture. Grew up, lived in a council estate initially in Deptford, and moved to sort of Rockley Lewisham when I was a bit older. So I think, to be fair, things were a bit spicy. So I grew up in a West Indian community in southeast London, which were, and in those days things were tougher than they are now for people of colour. I don't quite know. I think I was lucky with school. I had a really great teacher, a really good primary school teacher, who supported me through the first part of my life. And I went to his old secondary school rather than my local school. I didn't really make the grade for grammar school or for pushing forward. It's all a bit weird. Academically tested well, but not very good at people, I think, apparently. So I went to a local school, and from there to a local sixth form, and again was supported really well in that space, and applied to medical school pretty much on a whim, really, because I thought I'd go and end up working in the military. That was my plan, sort of like fix aeroplanes. And weirdly enough, I went to Barts for an interview, and they sort of like cut on my jib. I played rugby, and I did martial arts. It was all good. I got in, and the rest of it's kind of history, I suppose.
And then after you graduated medical school, where did you end up?
So miraculously enough, I did graduate medical school first time, having had a pretty tempestuous period of time in medical school. Most of it's a bit blurry, but a lot of it involved rugby. A lot of it involved sort of like running about around West Smithfield. I was a Barts student. And by some miracle, I got honours in surgery. I have no idea how it happened. It must have been one of those days, being kindly for me. So I did my surgical training locally, and I did the Barts sort of like local rotation, and I went off to the Royal Free to do anatomy demonstrator, a kind of stuff. Jumped into the Barts rotation, where I did my exams and failed and passed my exams, and I got a long period of time as an SHO, longer than it should have been. Got into registrar training at the first hurdle, and did my rotation again in North East Thames in general surgery and interested in vascular, and that was fine. Okay, enjoyed that. Loved working in Essex. Loved working with people there. Loved looking after patients. Loved working with committed, really talented, proper surgeons who are all about their patients and their care. Really, really hard-working, industrious, talented, really passionate clinicians. Working in district hospitals with no suggestion of any limelight or frippery, and then back into the real world in district hospitals with the ivory towers. And at that point, my sort of I've been a sort of like with a drongo as a vascular trainee, and I went to the Royal London and met a guy called Mike Walsh, who was a trauma and vascular consultant there, and he sort of had a look at me and said, "Do you like this trauma thing?" I thought, "That's all right." And I was really seduced by this fantastic atmosphere of hard work, supporting challenged patients in major trauma, doing great surgery, doing great clinical care, being good doctors, and working with nursing staff, with the therapists, with the patients, with the families to provide really awesome clinical care in a trauma setting, and it sort of bit with me. So when the opportunity came up to do a locum post there in that unit, that prestigious unit, I thought, wow. If they've got a gap in the razor for me, I'm having that straight away. So I jumped into that post, locum for a year and a half, and then again, miraculously enough, got a job, and there I am.
Amazing. And
yeah, crazy.
And then, what was life like as a early consultant? Young consultant?
Awful. It's the scariest time of my life. So you think you get your black belt in surgery, and you get your exams, and you get your job. You think, oh, I can relax, and actually you're sitting there with these two competing pressures to go, I've got to do everything and work really, really hard, and I can't do anything, I'm really scared. So you spend a year or so just running around in circles, operating and doing things and saying yes to projects and working harder and harder and harder. I think for the first 6 months as a surgical consultant, I had a heart rate of about 150 all day, every day, permanently anxious about everything I saw and did. And it wasn't until I started to do more and get more, I started to be more comfortable. It's really important to bear in mind that the reason I was made comfortable, I had tremendous training and worked in a really great environment. I had great mentorship and support from my colleagues, both senior and junior. And I had a lot of sense checking from home and from my friends who knew me from when before I was at medical school, who keep on still taking the mickey out of me because I was still slow at running. And I think that humanising the whole process is really important to me. So you start off in surgery, you think you're going to do the bee's knees, you get a new job, you work in the big centre, actually at the bottom of the pile again, and you don't know that much. You think you're great, you actually don't know that much at all. And you have to acquire those skills, acquire that sort of like mindset about consultant practice, understand how it's like to work with people long term, how to build those relationships, how to cement your practice, and how to start doing first what needs to be done, and then how to do things the way you want to do them, and then start setting a pattern about how that should and becoming integral to that service, and then moving beyond that service to do more than just your job.
And you said you had regular check-ins from home.
So I come from sort of like small nuclear, post-nuclear family, very extended Jamaican family around there, and they're not going to let me forget that I'm from Lewisham and that I owe them money. So I've permanently been checked in about that. And that's been great because I've got family in Jamaica. I go to Jamaica, come back from Jamaica, and those guys from school, sixth form, still check in with me. I've got obviously my medical school mates I met on day one 30 years ago. We're still friends. We were chatting on the phone, watching sport together on watch-alongs today, or at the weekend. We're still mates. And I think that you've got to maintain yourself. The thing about clinical practice and anything you are is you've got to maintain your integrity and your authenticity. You can't just change who you are to fit into a circumstance. You have to be a better version of yourself, and who you are is really important, and that's why you are where you are. And behaving like somebody else is never going to do any favors, and you're tempted to behave in a different way to sort of fit in, and friends, your real friends will tell you that's nonsense and to be yourself, and they will get back on you and make sure that you're well. Because I work in weird places doing weird jobs, and I moved way out where my original comfort zone clinically, and to have people who are going to make sure that happens is really important. I've got a family life. I've got a partner. I've got children, and they are bonkers like I am, and they reflect the characters in my life, but they are great anchors to life, because I think that I work to live. I work to live because I think that what I do isn't really so much about the cutting. It's about the fact that I work in for community. I serve the community, serve people around me. I think what I'm doing is part of Sacred Trust at Medical is all about, medicine's all about. And I think that you have to be part of that community and give back to the community and respect that community if you can do your job properly. And you can't just be somebody in a big pony riding in, doing the operation and dashing off again. It's about you understanding why where they got to, what the problems are, how you can help resolve the decision, how you can empower somebody to move on past that issue. And what you're doing is you're a witness to someone's life and you're supporting them in that space, but your role gives you the leverage to do more than just say that's a good or a bad thing. You can do more than just say that. And by your position, by whoever you are, you can represent who and what you stand for in that space. And that can be really helpful to people just by being in that space rather than saying anything in particular.
You said you've had really supportive colleagues and they've really helped you throughout your career, but what challenges have you personally had to overcome to get to where you are?
Loads of them, aren't there? I mean, there are internal and external challenges. There's the internal stuff about insecurity, because I'm incredibly insecure about what I am and what I do. And I still think that most of them get sacked when someone's going to knock on the door, a career away from me. They didn't actually pass finals after all. And I think that drives the kind of behaviours. And I come from a background where people then don't really achieve. No one in my family went to university. My mum's was an HCA rather than a professor. So the expectation of me academically was never that strong. And so coming as a relatively impoverished background, and being a South East London black lad, it was unusual at Barts. I was the only black person in my year. the only person in my medical school actually. And the last person in through Barts was in the 70s. And I arrived sort of like 10, 15 years later. And the last Jamaican through Barts was a guy who won an Olympic gold medal in 1948, I think it was, a guy called Arthur Wynne. So a bit of pressure there to perform. You know, he was also a fighter pilot, so, you know, covered both bases. And I think as a trainee, I think I stuck out for lots of reasons. I didn't sound, look, or act normally, or to the conceived pattern, and I took that to heart in lots of ways. And there's bias in there. There's bias against people of your colour, or because of your accent, because of where you're from, because you don't fit in, you're in the right school, and you know that's something you have to accept and move on with. And I think that as many people as there are who are going to actively object to your presence and your manner, there are people who are going to champion you as well. And I think the thing to bear in mind is that it's not about building resilience. That's a mistake. It's about building capacity. It's about acknowledging that you've got support in spaces that might not seem obvious to you. That if you're a black person, you have white allies. If you're female, you'll have male allies. You know, and if your gender choices are different or your sexuality changes are different, there'll be people who don't sit in that group who will support you. I think it's really important to recognise that that is part and parcel of what life's about. I think there's a huge journey. Mine was quite bendy and wavy, and it went up and down, lots of downs and ups, longer than perhaps it could have been. But the journey empowers me. The journey is fantastic. The journey was brilliant because I met amazing people and did amazing things and saw amazing stuff. I wouldn't have seen it. It would be a straightforward pathway. And I'm not bitter about it. I'm grateful for those people who supported me. I'm grateful for those guys who criticised me because they had in there was a kernel of truth that I had to deal with and handle, and I'm a better person for it. And also I've found great people who don't necessarily look or sound like me, who get what I'm about and share my values. And it's important to recognise that you don't have to be a version. Not everybody has to be the same to get on or to have the same set of skills or attitudes. You can have the same ethos, look completely different and sound completely different and be completely different. So it's about allying yourself to your principles. It's about being who you are, being a better version of who you are, and recognising that challenge is there to be dealt with. It is a challenge, and you are really good at what you do. The hardest having the support when you fail, because I failed a lot of things as a medical student and as an SHO, and as a registrar, and as a consultant, etc. And learning how to deal with poor outcomes is one of the hardest things, particularly if you're not naturally a sort of extrovert or confident person. And all this bluster and bluff and hand language is all shield a very anxious, scared young man inside. And I think that you have to recognise that everybody, absolutely everybody needs support. Actually, everybody has a weak moment. Actually, everybody needs to be reinforced and built up, and everybody reflects on their negative outcomes. But for you to progress, okay, you have to recognise that support is part and parcel of what you do. Failure is part and parcel of what you do, and that's a challenge to your personality, to your dedication, to your skill set. For people to come back on that again and to gain insight into yourself. You have to know who you are and why you do what you do. Or you can't do it. You can't do it well.
Is there a specific memory or strong memory that you have of an incident that you felt changed you during your training?
Yeah. When I was a sort of senior-ish registrar, I got caught up in looking after a lad who had been stabbed in the sort of groin area, had a really nasty vascular injury. And my boss, who was a very shouty, very aggressive Irish surgeon called Mike Walsh, gave me an absolute beasting when I was doing the operation. He was giving it the old-fashioned 70s, 80s consultant. He was swearing and cussing in my ear, let's go faster, do this, do that. Hacking away, claret everywhere. And I'm not really enjoying it at all. But I do the operation really well. Put the patient up. Boy does fine. I'm quivering jelly afterwards, and I'm writing my notes up, and I feel like it's been a disaster. I'm sweating buckets. And the next day, I'm going about my business, and I get a phone call from my boss and Mr. Walsh saying, like, get down to HDE now. And I thought, here we go. I went down there. He was standing by the patient's bedside, going through the notes. and I expecting a real beasting because the patient was awake and was doing well. And he looked at me, he looked at the patient, he said to the patient, "This young man saved your life." He said, "Just say thank you for it." I said, "Thank you. Well done." And that completely changed me, because I thought that everybody in that space was against me. I thought everybody was giving me a hard time, but he actually recognised that I was committed. He recognised that I cared. He recognised I was proficient. And he recognised that I needed the feedback. And then he wasn't perhaps the most eloquent of speakers, but he said, he made some say, he recognised what I did and said that somebody who really got value, because that person got value from my interaction. And that for me meant everything. It meant that he valued me as a clinician and as a colleague, and enough to broadcast that to the person who looked after it. And that meant a lot to me. And after we started talking a lot more about people and background and stuff, and that was a bridge towards us having a much closer relationship as a sort of mentor and mentee. And I thank him for giving me the opportunity to do that work and to have those difficult conversations and work in adversity with him and for him. And then when he went off to work in Africa, he gave me his job. So I've got a lot to thank him for.
And if you could go back in time, what would you say to yourself to inspire and to motivate yourself?
I would do neither. I would sit down with myself and have a cup of tea and just chat through stuff and just listen about the anxiety coming out of my head. I wouldn't give any direction. I would just say, just tell me about your life and say, look, it's all good. I've heard it all before. This is who you are, what you're willing to do. If this is your vision of your life, you go with it and don't give up on yourself, because it doesn't matter what I say to you. What matters is what's in your heart, what you want to do and where you want to go. And if that's what you want to do, it doesn't matter how long the pathway is or how windy it is. If you don't give up on yourself, people will see that within you and move on. So I would go back and I would listen, not talk.